Let's go ahead and get the call started. Mr. Jenkins, I'd love to have you kick us off here.
Thank you, Jeff. Guys, Jeff Jenkins. I'm the executive director with the Texas Chiropractic Association. And thank you guys for joining our webinar today. I do not think this could not be more pertinent in the moment. I am holding my breath to find out what my health premiums are going to be for next year and a little scared. I've heard some stories of other people have gotten their notices of how much their premiums are going to go up. So I think now is the right time for you guys to be doing some research. And we certainly are big believers in impact health sharing as a great alternative for your health care. It will fit for many, many families. I know we've helped quite a few TCA members get coverage for, themselves, their families, their staff, and we hope you find this information useful. As Jeff mentioned, we are going to record it. We're going to distribute the recording in our newsletter eSource on Friday. It'll be on our socials. So if you know a doctor who was not on the webinar today, send them the link to the replay because TCA wants to help as many of our member doctors as possible, deal with this particular issue. But Jeff, big thank you guys for working with TCA. We are a great partner and we certainly appreciate everything that you do. So enjoy the webinar and let's learn.
Well, Jeff, thank you. It's an honor to be on the call with everybody today. And some of you guys have had the opportunity to meet at different TCA events. We've been to the convention in Frisco the last couple years in a row with tables and been to some of the different social events and also the West Texas event in Lubbock last year as well. So just been able to develop a lot of great relationships and a lot of friends and you guys as community. I was born with spina bifida and also with diastema myopia. So I had a couple major back surgeries the first few years of my life. I started getting chiropractic care literally in middle school, and it was transformative to me. And so I love having an opportunity to get a chance to be a part of this community with you guys and just love what you're doing to help the wellness of people. So guys, let me just share a little bit about impact health sharing. We had the opportunity to listen to Jeff talk about just the timing right now with healthcare. I'm going to talk about that today. But first off, just a couple bullet points about Impact. Impact was founded in 2020. Since then, we have saved and shared $275 million in medical bills since 2020. Impact currently has 18,000 plus members. We're actually just about to hit 19,000 members as of November 1st. We'll roll over the 19,000 member mark. We've been 5+ years with no universal price increases. So as you see healthcare costs going up everywhere, Impact has never had a price increase since they started in 2020. And for you guys as providers, one thing that you'll love is providers of Impact are getting paid. Dr. Tice is my personal chiropractor. They're getting paid on average in under 15 days time from Impact. So we're leading the industry when it comes to payments for providers. So, right now we're having double-digit premium increases all throughout the US when it comes to health insurance. The increase this year is the highest health insurance premium increase in history here in Texas, where I believe just about all of us live. On average, there's a 31% increase when it comes to health insurance premiums as of January 2026. Here in Texas, here's a bunch of news clippings just for the last couple of weeks, but it talks about how 22 million people may see a sharp increase in health insurance premiums in 2026. I know Dr. Andrew Ateo, who's the VP of the TCA, just told Jeff over the last couple of days, he just got his renewal letter in the mail and his premium for his family went up by $9,600 a year. He had an $800 a month increase and he said, okay, I know we've been working with Impact. I got to learn more about how this can be an alternative and a potential solution for my family. So here's the truth about healthcare, and I know I'm preaching to the choir where, this makes a lot of sense to a lot of you guys, but 80% of the country is trying to lower their healthcare costs. And here's why Impact makes sense once you put all the pieces together. 5% of the population is responsible for 50% or more of the annual healthcare spend in our country. So what this means is the other 95% of the population, I fell into that category, is collectively responsible for the other 50%. So most people are healthy or fairly healthy and paying a significant amount of money for their health insurance to have to overcompensate for people that are not healthy. Over 100 million Americans right now are in some kind of health insurance debt. So the traditional health insurance model really is not working for a lot of people. And so with Impact, we're really redefining healthcare with heart. Impact is built for people, not built for profits. And healthcare sharing, many of you guys have probably heard of Liberty Share, maybe you've heard of MediShare, Christian Health Ministries, Samaritan. Healthcare sharing is not a new concept. It's been around now for 40 plus years. And here's some of the benefits of Impact Health Sharing. It feels like traditional health insurance, even though it's not insurance. It's the most modern and contemporary version of healthcare sharing available today. With Impact, there's no religious requirements. All creeds are welcomed. Impact is set apart from others because of the way it manages their billing. I'll show you how that works. And we have an inclusive desire to help as many people as possible with our reference-based repricing model. Now, here's some of my favorite bullet points when it comes to Impact. Again, Impact is not insurance. We believe it's something better for most people. With Impact, there's no provider restrictions. So you can see any doctor you want anywhere in the country and never pay an out-of-network penalty fee. Comprehensive healthcare. So everything from a cough to a car accident to cancer. No utilization reviews. That means you as the provider or any doctor that you go to doesn't have to worry about what's in the insurance company's guidelines and how they treat their patient. You can actually treat your patient, or a doctor can treat you based on their medical experience and their medical expertise, not based on the guidelines of an insurance company. We have year-round enrollment. So even though open enrollment starts November 1st, somebody can become an Impact member at any time of the year, and your Impact membership begins the first day of the next calendar month. Complimentary 24 telemedicine. Every member also gets a free annual wellness visit. Dr. Tice, he's my chiropractor, but also he has a provider there in his office where I go to his office to also get my annual physical. I go there to get my blood work done as well. And every member gets a free annual wellness visit, also a $150 blood work credit. The other thing that's neat is Impact has a concierge service where, let's say you want to go to your primary care physician to go get your physical and they've never worked with Impact before. I recommend people go and get that annual wellness visit their first 30 or 60 days as a member. Ladies, you can also use it for your ladies visit if you choose to as well. But if the provider does not want to bill Impact electronically, Impact's concierge team will actually call the provider and they will prepay for your annual wellness visit before you even walk into your appointment. So imagine a healthcare company paying you before you see a patient. And so what's amazing about that is Impact can really create that relationship with your primary care provider immediately. And they are obviously not used to getting paid prior to a patient walking into their office. So Impact also has the best wholesale prescription pricing in the industry. They've got an amazing dental and vision savings program for no additional cost as well. It's community-based support. And they also have an amazing exclusive health and wellness reward credit, up to $150 a month credit that you get as a reward for being healthy and living a healthy lifestyle, that actually basically allows you to buy down your PRA or your deductible every month. Here's what I mean by this. So anybody that has DPC memberships, does naturopathic services, naturopathic medications, gym memberships, fitness class, subscription, massage therapy, acupuncture, supplements. I buy multiple supplements from Tice's office. I also get sound wave therapy in my shoulder as well. You know, anything that you do like that, as long as you have $150 of receipts per month for your entire family, you just submit those receipts in and it basically buys down your deductible. I'll show you guys here in a few minutes on how my wife and I literally zero out our deductible within about 8 months, even without having to go out and get any medical treatment, just for doing the right thing to live a healthy lifestyle and be healthy people. Now, also Impact does 50 chiropractic adjustments per year per member of the family as well. So if this is something your patients are interested in, for me, I go to Dr. Tice usually at least twice a month, and I can take those adjustments, and that goes towards my deductible. Once I've hit my PRA or my deductible, they actually pay him directly for my chiropractic visits, which are great. Now, who is Impact for? Impact Health Sharing might not be for everybody, but it's for many individuals, especially those that are generally healthy. It offers an affordable solution, really like no other. Impact is for individuals, families, entrepreneurs, people that are self-employed, freelancers, service industry workers, seniors that have Medicare Part A and B. Impact is a great program for seniors, and also small businesses. I know many of you have employees, and some of you are looking to offer benefits to your employees. You know, we've got Dr. Steve Von Osdale on the call. I'll have him share later on the savings that he was able to get when it comes to his employees with Impact. Now, here's some terms that we're going to talk about today. And in the traditional insurance world, you know the term deductible. In the healthcare sharing world, that same word is synonymous with what we call primary responsibility amount. So when I say PRA or primary responsibility amount, just think deductible. When I say provider, think copay. When I say eligible for sharing, think covered or coverage. When I say co-share, that's the same thing as co-insurance. So the terms are just a little bit different in the healthcare sharing space, but they mean the same thing. Now, I mentioned Impact's not going to be the right fit for everybody. Our guidelines are extremely transparent. They're very simple to follow. I'll put the guidelines in the chat here in a little bit, or you can get the guidelines on impacthealthsharing.com. But Impact, like I mentioned, is for people that are healthy or fairly healthy. For my wife and I, we saved $8,000 a year when we switched over to Impact. And when we first got our quote, we were blown away, but we also didn't understand really how that was possible. Well, when they said what I shared with you guys earlier on, it's what made it make sense to me. 5% of the population equates to 50% of the healthcare spend in the country. Again, the other 95% equates to the other 50%. So most people are healthy or fairly healthy, and again, really overpaying for their healthcare costs. So with Impact, anybody can become a member. We accept anybody, but if somebody has pre-existing medical conditions, those pre-existing conditions are not shareable to the community until somebody's been sign, symptom, and treatment and diagnosis free for 36 months. Once those conditions are sign, symptom, treatment, diagnosis free for 36 months, those become shareable. So it made sense to me why Impact's costs were so much lower, because we're reducing the risk factor, because we're attracting mostly healthy and fairly healthy people. Now, the one exception to this is high blood pressure and high cholesterol. Anybody that has high blood pressure or high cholesterol, as long as it's under control, Impact will not count that, will not hold that against somebody when it comes to determining any eligibility for any future cardiac or vascular events, as long as it's under control. And so what is Impact for? Impact is for new accidents, new illnesses, new injuries. After your annual PRA is paid, eligible medical bills are then shared by the community at 90%. You're responsible for the remaining 10%. That's called your co-share. The most a family could ever pay per year in co-share is $5,000 a year per family. If you ever meet that $5,000 maximum, think of that like a max out-of-pocket expense. At that point, Impact will share in a 100% of your eligible medical bills after you've met that $5,000 mark. Now, your annual primary responsibility amount. This is the total that each household may pay annually towards their eligible medical bill before additional expenses become eligible for sharing with the member community. Members under 65 can choose from 4 different options. You'll see that in a minute. The annual primary responsibility amount, again, like a combined family deductible, will only be met when with eligible medical bills and through those $150 credits through the Wellness Reward Program. So with Impact, prices start as low as $73 a month for individuals, as low as $378 a month for families, and as low as $96 a month for seniors that are 65 years old or older. So let me just share with you guys, I'm going to show you the TCA portal. This is where somebody would go to actually get a quote. And after giving the quote, I'd love to have Dr. Tice just share a little bit about his experience. And so this is the TCA portal. They are a referral partner with Impact. So this is their portal. It's got the TCA logo on here. And so to get a quote, all you do is put in the date of birth of the oldest person in the family, Let's say it's March 30th, 1989. Somebody that's 36 years old, family of 3 plus. I hit get quote. And there's the quote for that family. So as the slide said a minute ago, anybody that's under 65, they're going to have 4 different options. Now, everything on the 4 different options is exactly the same, other than the primary responsibility amount that you choose and the rate that you pay each month. So the lower your primary responsibility amount or the lower your combined family deductible, the higher your monthly rate's going to be. The higher your PRA, the lower your monthly rate's going to be. So you see for this family of 3 plus, 36 years old, if they chose the $2,500 combined family deductible, they'd be paying $576 a month. If they chose the $10,000 PRA, they'd be paying $404 a month. Now, once they hit their deductible or their PRA, they now go into co-sharing. So as we said before, at that point, the impact community will share in a 90% of your medical bill. You're just responsible for 10%. And the most, again, you can pay per year in that co-share is $5,000 per year. That's your out-of-pocket maximum. If you ever hit that, the impact community will share into 100% of your medical bills. Now, let's say somebody at the same age, it was just one single individual. We hit get quote. There's their quote, anywhere from 102 to 246, depending on their PRA. So you can go to the TCA's Impact website and you can get yourself a quote. It's that simple. We'll make sure the link is in the follow-up email for everybody. And then if you have questions once you get your quote, there's an AI chatbot right here. And you can literally ask the chatbot any question that you want. It'll answer any question that you have. It's really thorough. Now, if at that point you're still like, hey, I want to talk to somebody and learn more, you can submit yourself in as a lead, name, email, phone number, click on learn more. Impact will send you a text message and an email with a calendar invite to help you get any questions that you have answered. They'll get a call scheduled with you. The other thing that's neat about that, I know that some of the docs also became referral partners with Impact. I'll talk about that at the end, but some of the docs have Impact banners with QR codes in their front waiting rooms where a patient can actually scan the QR code. They can go right to that page. They can get a quote. The chatbot will answer their questions. And if they decide to enroll and become a member, if you happen to become a referral partner, you make an ongoing residual income every month when they pay their plan. Matter of fact, you can also get a residual on your own plan if you choose to be a referral partner. So Dr. Tice is a great referral partner for us. He's also my chiropractor. He's also a preferred provider with Impact. So there's also an opportunity to be a preferred provider where Impact, we want to push more members to you as well and help you get more patients through your front door. But Dr. Tice, if you could, love to have you just share a little bit about your experience.
Sure. So we were familiar with health sharing. My family had been on a couple different health sharing plans before, and my health insurance broker actually is who introduced us to Impact. And we were looking at, where's the catch? I mean, how can they do this? It was a different game than what we had played before. I mean, with most health sharing plans, you've got to come out of pocket, and then you've got to negotiate with the hospitals, doctors' offices, everywhere you go. You got to pay cash out of pocket, and then you hope that you get reimbursed. And usually you end up eating it unless it's something major. So we were looking at it, first of all, for us, and then second of all, when I was TCA president, our members were, coming to us every year saying, hey, can we do a group plan? Well, if you didn't put together a group health insurance plan before Obamacare was enacted, you don't have a group big enough, and your group can't afford the premiums. You're not going to do any better than you do on the exchange. So this looked like something that had a lot more teeth to it. So we started, kicking the tires on it. I became a preferred provider just to see what that process looked like. I think it took about 5 days. I got to negotiate my rates for the very first time in 27 years. I got to actually negotiate what I thought a fair fee was for an adjustment, and it's not what Blue Cross and Humana pay me. I think we got like 150% of what Medicare allows, and that's for every code that's in Medicare's book. So it doesn't, it doesn't follow Medicare rules. It's just that's the fee schedule. So um, it, we had our first impact patient that came in. I, they say 15 days or less. I think it was 10 days. We got we got an EOB back in 10 days. Um, we had questions about how to become how to TCA could become a referral partner and bring this to its membership. The CEO of Impact gets on the phone with us. Very easy, super transparent process. Just the people that are involved with Impact are just top notch. One of my patients decided to become an Impact member. Her husband had to have an emergency heart procedure. Of course, she's freaking out because the Baylor Hospital says, "Oh, we don't take health share. You're going to have to pay $109,000 out of pocket for this procedure." Of course, Impact gets on the phone with her, calms her down, gets on the phone with Baylor. He has his procedure, everything goes fine, and it's 100% shared. Uh, and she was, she had peace of mind where she didn't have that before with her Blue Cross plan with $10,000 deductible, because at least 10,000 of those dollars would have been out of her pocket. So it's been a win all the way around.
Well, Dr. Tice, I really appreciate you being on the call and just sharing, your experience. And I thought it was important for you guys to know that, again, not only is Impact very member-centric and can this potentially save you and your office a lot of money, but they're also very provider-friendly, which I know is important for you guys as well. You don't need to be a preferred provider to be an Impact member. But if you want to learn about being a preferred provider, obviously we want to continue to grow the Impact community, and we want to send patients your way, as well. And I love how Dr. Tice just shared some of the provider benefits there. So again, very simple to go out and get yourself a quote. For anybody that's over 65, we do also have a program for seniors. For seniors that are 65 and older, Impact works along Medicare Part A and Part B to help fill the gaps that Medicare allows but doesn't fully pay. So typically Medicare A and B will cover 80% of those medical bills. Impact jumps in and covers or shares in the other 20%. So members that are enrolled in the senior plan, they get a $1,000 primary responsibility amount annually, freedom to keep their trusted providers, again, no network restrictions. With seniors, there's no pre-existing condition limitations, and there's no providers, and there's no co-share, no provider fees, and no co-share once their $1,000 annual PRA is met. So just as an example, for a senior that's 65 years old, it's $96 for Impact. If somebody has Medicare Part D, Impact will also share in their Part D. There's additional perks and savings starting at day one, unlimited 24 telemedicine, virtual mental health as well. We have a great Life Vitals program I'll show you guys at the end. But this is what the Impact card looks like. So as Dr. Tice mentioned, Impact is architected and designed to really look and feel like traditional insurance. So as Tice mentioned, most of the time with health sharing, you would go to the provider, you would pay as a cash pay discount, you get your super bill, and you'd submit it to get reimbursed, which sometimes took a long time, sometimes was a real cumbersome process. So with Impact, Impact invested the money to be in all the clearinghouses in the country, so they have an EDI payer ID number. So a provider can just put Impact's payer ID number in their billing system, and they can bill Impact electronically just like they would an insurance company. So that's how Impact is designed and architected to work. Now, I'll be very transparent with you guys. That's how it's supposed to work. Sometimes there's going to be a provider pushback. As Dr. Tice just mentioned with Baylor, sometimes when they see healthcare sharing, they automatically think somebody has to pay up front and then submit their receipt to get reimbursed. So if we ever have that provider pushback, we just let them know, listen, we're billed, we're coded the same way as commercial insurance. Just put our payer ID number in the billing system and you can bill us like insurance. If for any reason they won't, there's a provider support number on the top of the card. They can call the provider support number. They'll tell them how fast they pay and how much they pay. Usually that's very, very friendly to a provider's ears. But if for any reason they still won't bill Impact, as a worst case scenario, we can pay as a cash pay discount, take the bill, submit it to Impact. Impact will reimburse us as the member as fast as they're paying their provider, as long as you've already met your PRA. If you haven't met your PRA yet, they'll just apply what you paid to the PRA. So again, everybody gets a free annual wellness visit, $150 blood work credit per member as well, 50 chiropractic adjustments per year per member of the family, unlimited free telemedicine, 3 virtual mental health televisits per month as well at no charge. If somebody wants to go back to their PCP, it's a $50 fee. Urgent care is $75. Specialist is a $75 provider fee, which is again is like a copay. Outpatient services is $75, and ER and inpatient is $150. Now, once a provider bills Impact, Impact is now going to negotiate on our behalf. They want to make sure that members are paying fair market value. Now, I know that you guys are all doing the right thing for your patients, but I'm sure you know there's a lot of hospitals not doing the right thing. And there's a lot of significant overcharging going on. There's hospitals that are charging 5, 6, 700% of the Medicare rate to their patients. So here's just a couple examples. Here's my mother-in-law. We took her to the emergency room here in Highland Village, where I live. She had not met her PRA yet. They sent the bill to Impact. It was $2,500. Impact advocated on her behalf, negotiated it to $164.98. So even though she hadn't met her deductible yet, they still just billed Impact, and Impact negotiated on her behalf. So she had to pay the $164.98. That was then subtracted from what she originally had as her $2,500 deductible. Here's another individual. Some people are like, well, what about the big things? How does catastrophic work with Impact? Here's a friend of my wife's that's right now just rang the bell and beat stage 3 breast cancer. But this is as she was going through it. So at this point, she had met her $2,500 PRA. Now she was at her 10% co-share. So this bill for this chemotherapy was $121,000. Impact negotiated the bill to $28,000. The community paid $25,478. She had to pay her 10% co-share, $2,830. That was her responsibility on that $121,000 medical bill. Now, same exact woman had a couple more treatments. She maxed out her $5,000 10% co-share. Now the community pays for 100% of her medical bills. So here was another chemo treatment, $70,000. It got repriced to $15,287. The Impact community paid the entire $15,000. Her responsibility was $0. Now, the last thing I want to show you guys, and then we'll just get questions answered. This is something that really just made me so excited about Impact's heart and their transparency. They show the books. How much healthcare companies are not showing the books right now? And so with Impact, they show how every dollar moves. So every member, like myself, we have what's called decentralized reserves. So this is my personal Impact dashboard right here. I can see what's in my account right now, just sitting there in reserves. I can see what families I've recently helped. The Pertuis household, my account gave $49.50 towards one of their medical bills. The Yeager household, my account shared in $150.68 of their medical bills. But I love that these are real people, and I can see where the money's going. A few months ago, one of my friends, his wife was going through cancer. My account actually shared in part of her medical bill. She showed up as a name on my member center. And for me, that was so much fulfillment, because I don't know about you guys, but when I paid my health insurance premium, I had no idea where the money went. Here, I can send these families a prayer request if I want to. I can send them a get well notice, or I can remain anonymous if I choose to as well. But Impact shows how every dollar moves. What stays in the share, what goes towards program fees, what goes towards admin fees. You can even see the entire community. And this was a screenshot of earlier on this month. At that point, we had 18,612 members. They show what do they have in financial reserves. At this point, they had $14,038,000 in financial reserves. Now, the goal of a healthy health sharing company is 3 to 4 months of financial reserves. You can see in the last 12 months, we've shared in $14 million in medical bills, shared in 76,070 bills in the last 12 months. So we have more money in reserves than we've actually shared in the last 12 months. That's extremely abnormal in this industry. Medishare raised their rates this year by 12%. Here's why. Their reserves are getting too low. They had to raise the rates just to keep the base safe. Impact has over 1 year of reserves, which is very abnormal, in this sharing world. So because of that, it allows us to give our members additional free member benefits. Because remember, they're a nonprofit. They don't need to have a year in reserves. There's no reason a nonprofit has to have that much money in excess. But they show the largest shares from last month. They just show everything. And I love the transparency, but also remember the health and wellness credit. Again, anybody that spends at least $150 a month on your health, whether it's vitamins, supplements, gym memberships, holistic wellness, IV drip, naturopathic medicine, anything like that, you submit that bill, you get a $150 credit every month to offset your family deductible. So here's my account. My wife and I have a $2,500 combined family deductible. We've had no medical bills. We had our membership renewed on July 1st. We've already used almost $500 of our PRA, and we've had no medical bills. That was just from some of my adjustments with Dr. Tice and those $150 wellness rewards credits. I've already used 20% of my deductible in the first 3 months of my membership, which is awesome. Now, lastly, guys, coming soon, actually, this just launched last week. We have a brand new prescription partner. It's called Livinity. And so just another new member benefit that Impact did. Anybody that has prescriptions that are under $10 a month for generics, Impact pays for that 100%. Also, really great discounts on brand and specialty meds. Telehealth, again, 24/7 free unlimited telemedicine, less than a 5-minute callback time once somebody submits themselves for telemedicine. Also, 3 virtual mental health visits per month per member. I think all of us would agree since COVID, mental health has been a bigger challenge in our country. And we give every member 3 telehealth virtual mental health therapy visits per month complimentary. And then we've got Life Vitals that we're about to roll out. Impact, not only do they want to attract healthy members, they want to keep the membership base healthy. So this will be a scan that you can do literally right on your phone, where it'll measure things like heart rate, breathing, blood pressure, cardio workload, mental health stress level, just some amazing things. And again, this will be complimentary for all the members. This is going to roll out in December. This is our Facebook group. So we've got thousands of members in our Facebook group. There's a lot of great member testimonials on there. Anybody can join the Facebook group. There's a lot of great information. We do a weekly webinar every Tuesday at 11 a.m. Where we go really thorough into this, and we have member spotlights each week. This week, we had a gentleman who his family just had their first child. So he went through maternity with Impact. He was showing the medical bills, and it was amazing how much money. As a matter of fact, his doctor said, whatever this is, I want to be a referral partner just based on going through that process with him, which leads me to my last point. For those that after hearing this, you're like, hey, not only do I want to learn more about this for myself and my staff, but if there's a way that I can make residual income for being a referral partner, I want to know about that as well. Here is Dr. Don White, TCA president, with his banner. We've got some of the other TCA board members with their banners there. And so there is also an opportunity for people that want to be a referral partner to earn residual income by sharing impact with individuals, families, and small businesses. So we've got Dr. Steve on the call here today, I believe. And Dr. Steve, I'd love to have you just kind of share a little bit from your experience of what Impact did for your, for your small business. I know you know many of the folks that are on here, but if you can unmute, love to have you share a little bit about your story.
Yeah, thanks, Jeff. So for me, I was providing insurance not just for my family, but also for my staff. And I also was using a company that had the logo of a Blue Cross and a Blue Shield on it. And so we looked at this option, and it has been a game changer for us. We saved over $1,700 per month for family and staff. As a small business owner, that was huge. We were able to repurpose that money to put that towards another staff member, which enabled us to treat more people. And as a result of that, we were blessed as well. We have some staff members that are single parents, and they're thankful for it. We had one individual who just a few months ago went to the urgent care here in Lubbock, and the bill was over $900. It was negotiated down to $400. She saved over $500 on that one visit towards her deductible there, her PRA. So I can't say enough good things about it. It works. From a small business owner, it's tremendous because it allows me to be to offer benefits to people, and in this market people are looking for benefits, and if that's one thing that I can do that the other office down the street doesn't do, that gives me a tremendous advantage. And then to save the money, repurpose it, it's just a win-win for me.
Well, Dr. Steve, always a pleasure to see you, my friend. Thanks for hopping on the call. At this point, guys, I just want to be able to do Q&A with everybody. Anybody that wants me to give you a quote, I'll do that as well. For anybody that didn't hear in the beginning of the call, we were talking about how November 1st starts open enrollment and just the premium increases this year. For the state of Texas, it's an average increase of 31%. Dr. Andrew Ateo, TCA Vice President, had just shared with Jeff Jenkins a couple days ago. For his family, his went up by $800 a month this year, by $9,600 a year increase. So if you haven't gotten your letter yet, it's coming. The increases are significant, but we have a solution for a lot of people that really can be a game changer. But if you're somebody that after we get through the TCA, you can take a screenshot of this after we go through questions. If you're somebody like, hey, how do I sign up to be an Impact member, to be a customer? I'll text you the TCA link. It also will go in the follow-up email. But anybody that wants to learn more about the business opportunity to be a referral partner and earn residual income, through our program, if either one of those fits you, that's my personal cell number on the screen. So if you text me your name and either customer, meaning you want to learn more about, you want to have the enrollment link on how to enroll as an Impact member, or if you want to learn about the business opportunity, you can text the word partner to me. So just text your name and either the word customer or the word partner, or both. Obviously, if you're interested in both, text that to me and I'll make sure I get you that right information. So I'll leave this up here in a minute, but I definitely wanted to be able to take questions at this point. I went through a lot of information with you guys as fast as I could. Anybody have any questions, guys? No questions, a bad question. Dr. Awad, go ahead. I saw you with your hand up first.
Couple questions. Okay, just to clarify, so this is, you can go any provider, so it's not like a HMO or anything like that. We have to go to PCP, or you can go straight to the provider you want to go see, correct?
Correct. No referrals needed. And remember, as I mentioned, at the worst case scenario, if the provider won't bill Impact, then you pay cash pay and submit your medical bill for reimbursement. Now, if it's for your annual wellness visit, if it's for your physical, they will call and pay first before you even go there. So that's why I encourage everybody, when they become a member, in their first 30 to 60 days, schedule that annual wellness visit, because then Impact will create that relationship with your primary care provider immediately. And I'm sure you've probably never had a healthcare company pay for a member before they've paid for a client before they walked in the doors, right?
Right, absolutely.
Now,
What if you're,
sorry, go ahead.
what if you're also interested in becoming a provider as well?
Yeah, so super simple. You can text me the word provider too. I'll send you the link. You just submit yourself in, and somebody from our provider support team is going to reach out to you. Typically takes under 30 days to get credentialed. Ty said his took 5 days, which is awesome. Sometimes it's that fast, but I like to just set an expectation of usually under 30 days. And then again, as an Impact member, in our back office portal, remember, we can go anywhere. But in our portal, we can look up preferred providers that we know already are familiar with Impact and go there. So again, our goal would be, again, as many of you guys that are interested in becoming preferred providers, any of our members that are near you, I know you're in Arlington, Dr. Awad. If I'm an Impact member and I live in Arlington and I want to get an adjustment, I go on my portal and I see your name. Obviously, there's a chance I'm going to go, I want to go see Dr. Awad there. So yeah, if you text me the information, text me that, I'll send you the link to become a preferred provider. It's real simple.
Okay, cool. Awesome. Thank you.
Great question. Did my answer make sense to you?
Yes, sir.
Do you want me to give you a quick quote, Dr. Awad, just to get an idea what it looks like for you?
Sure.
Yeah, let me just pull the portal back up. What is the date of birth of the oldest person in your family?
Well, that would obviously be me. It's 12771.
127.71. And then how many
Yes.
people are on your plan?
It's me and two boys, so three.
Okay. All right. So for you guys, anywhere from 628 with the $2,500 combined family deductible down to 456 if you get the $10,000 combined family deductible. And remember, every month you can submit those $150 in health and wellness. And just like I showed in my example, that gets taken off the top of that number, every month. But that's what you're looking at for your family, and it's for 3+. So if you happen to decide to have another one, the price stays the
No.
same.
That's a no.
Yeah. Put it out
Okay.
there just in case. So, hey, who else has a question, guys? Again, no questions are bad questions, and definitely just want to help in any way that I can. And everybody's on mute if you're trying to say anything. Mr. Jenkins, go ahead, buddy.
Great information. This gets more and more exciting, particularly in the times we live in. So if you guys, Jeff, did you put your contact information in the chat where they can reach you?
Yep.
I did put the link for the TCA webpage that Impact created for us. That's how you're going to like get quotes and be connected. So check out that link. And
Yep.
tell your colleagues, tell the people that the other doctors in Texas about this, because obviously we want to make sure that everybody gets the best coverage they can for the best value. It's very hard to beat Impact Health Sharing. So Jeff, thank you.
No, you're welcome, Jeff. And then, again, I put my number in the chat, but also again, anybody that wants to, have the access on how to get enrolled as an Impact member. One thing that is really important, I want to mention too, for anybody that wants to be a member by November 1st, they would have to just complete their enrollment to become an Impact member by 4:59 Central Time this Friday, October 31st, to have a November 1st start date. If you complete it in November, that's fine too. You'll just have a December 1st start date. So it's by 4:59 Central Time, the last day of a month, makes you a member the next calendar month. So again, anybody that wants me to send that link to you to get yourself a quote or even enroll as an Impact member, text me your name and the word customer to that phone number. And for those of you that want to learn about the residual income opportunity side, you can text me the word partner and your name to that number. And as Dr. Awad said, if you want to learn more about being a preferred provider, you can text me the word provider and your name to that same information. And obviously, if you're interested in all of them, you can put customer, partner, provider. You can put it all on there, and I'll reach out to you, make sure you have the right information. But I'm really grateful for everybody spending their lunchtime with us today. I know that there's a lot of adjustments to be done later on. Hopefully, I gave you guys a good little mental adjustment when it comes to healthcare costs. But anybody else have any last questions or comments before we wrap up today? All right, guys. Well, the recording is going to get out to you guys ASAP. It'll get sent into the newsletter. And Jeff, thank you again so much for having me on today, and just love getting a chance to be part of the TCA community. By the way, I recommended a chiropractor to Dr. Don the other day, somebody that I met that's not part of the TCA yet. So I got him connected to Dr. Don about talking about being a TCA member. So hopefully we can help you guys to also grow the TCA membership base as well, because I believe so much in what you guys are doing. So thanks for everything you do, Jeff.
Thank you, Jeff. Have a great day, everyone. See you soon.
Bye, everybody.